I'm Dr. Michael Caruso, and I want to talk to you about some simple things that you can do for movement system pain. It doesn't involve medications and it doesn't involve surgery. It is based on a new understanding how the movement system works, and that has to do with the development of the research around the fascia system. And these can be persistent movement problems that have extended over a long period of time, but it has to do with areas that commonly get restricted and that could be addressed readily using movement patterns. And the reason this understanding is important is because we now know that the muscles and the way muscles function around joints is much different than we typically thought. And this has to involve around the research around the fascia system and how the fascia system and the muscle system work in partnership. Because each muscle, we typically think about muscles attached to tendon and then attached to bone and create movement in this simple biomechanical model. And we now know that that's outdated. We now know that, for instance, each muscle fiber is wrapped in an endomysium in a fascia sheet, which is part of that muscle. And then these muscles are wrapped in bundles called the perimysium, and then those bundles are wrapped in the epimysium. And that all functions as a unit, close force-producing unit. So in addition to muscle working on tendon, working into the joint, we also have this epimysium around the muscle fiber, which attaches to the muscle and to the tendon and extends into the joint, which creates movement through that attachment of the epimysium. And those extensions go into neighboring muscles as well. Some of those muscles acting in the same direction, some in opposite directions. So we now think of this muscle fascia continuum not just creating compression around the joint, but also creating an environment of tension and shear around the joint. So as a model, it may be more helpful to think of that the body has this fabric, this fascia fabric that has muscle compartments that have bone spacers. So that's a much different model for how we understand how force distributes to the body. So when we have an area of irritation and we can see it on MRI and we see a problem, typically many people have these same kinds of common problems in the back and shoulder and hips that typically when they don't respond to exercise, we typically think, well, they need a surgical procedure. But since we now know that many people have these same problems without any symptoms, there must be something else going on. And it probably has to do with how the muscle fascia system is working. And the fascia system is quite complex, especially in the limbs, because each muscle is wrapped around this epimysium extensions. But then on top of that, there's an aponeurosis, which is a second layer of force-producing fascia throughout the limbs. And the trunk, it works a little differently, but it also all works as a system. So I'm going to show you some common problems that are stuck and some things we can do about it that are simple to address with some things that you can find around the house. So here we go. Okay, I'm going to start with a pillowcase. It's a simple pillowcase, standard pillowcase. I'm going to roll it up. And that makes a firm cloth roll. And you can start with one of these, or you can wrap a second one around it to make it a little denser roll. Or here I have 2 rolls and a towel. So I'm going to use that as an example here. I'm going to put that down and lay down across that roll. My arms up in the air. For some people, just starting with a single roll is quite enough. So you put the roll there. Just that dense roll underneath can be quite a bit. Even a small roll can be too much in terms of strain on the neck. So you just pad the neck up a little bit and then do your exercises in this direction to help loosen up the chest area, especially in the back and that whole fascia system. Okay, continuing with this idea of moving the fascia system and getting mobility throughout the whole system, we're going to use this training stick to create movement in a specific area. So I'm going to put this stick on my back, and to make sure that I have a space, small space, the width of my palm in the low back area, and I'm going to push the hips backward. What I'm going to emphasize here is that the movement is happening at the hips while I'm maintaining this curve in the lumbar spine, and I'm maintaining a flat upper back area. So that's creating a stretch through the thoracolumbar fascia and through the glute area, down into the hamstrings, iliotibial band, and right down into the lower legs. So we're creating this stretch and pushing the hips back and maintaining a lumbar spine. Typically, people have difficulty with this. When they try to do this, they wind up rounding their low back down here, because as they come over, they're too tight through here. This comes rounded up. So we're really creating a different movement pattern than a lot of people typically use. So pushing the butt back and coming way over creates a stretch through the hamstrings. And I'm going to show you how, in the next step, how we're going to work on more focusing on this area. Okay, now that we know how to do a hip hinge, that's going to train us to keep our torso in alignment. And now we're going to add in a second component to work on the lats, get the lats stretched out, keeping the torso in a certain position, and that will create a stretch in the bottom half of this posterior fascia network that will involve the thoracolumbar fascia into the glutes and down into the lower legs. So I'm going to use this countertop, step back a little bit, push my pelvis back with my knees bent initially, push all the way back, bring my torso down. I want to get deep into that curve as far as I can go. If I can only go this far, this is good. And now I want to stretch the knees straight. Now for some people, they're going to have a really hard time maintaining this curve in the lumbar spine, but it's important to do that. Otherwise the stretch happens up here and we avoid getting the stretch where we want it down here in the lower legs. So come down. And that may take a while to develop, but it's a good way to create some flexibility in this muscle fascial system that a lot of people have trouble with.